Let's talk about a very easy way to cold test teeth. When a patient presents in your office and they say, oh, I've got sensitive teeth, and they can't locate the tooth, this is a very easy and effective way to diagnose which tooth is the culprit. Here's another thought. If a patient ever presents in your office and they say, all my teeth are sensitive to hot and cold, what is that? That's clenching and bruxism. If somebody ever says, all my teeth are sensitive to hot and cold on both sides, that is 99.9% of the time, that's clenching and bruxism. And that's another dental minute. But if they say, I've got sensitivity on my right side, I'm not sure which tooth it is, the technique I'm about to show you is very easy and very effective. This patient had sensitivity in different areas. Now what we're doing here is taking a anesthetic carpule that's empty, putting some dental floss in that empty anesthetic carpule. Now put a pretty thick piece of floss, like waxed floss. Then you're going to fill it with water, put it in a cup so you can do several at one time, and then put it in the freezer. Take a little while to freeze, and so this is frozen water with the dental floss extending into the ice. To warm it up so you can get it out, you've got to rub your hands together on the carpule. It's not going to just come straight out. You got to rub it between your hands so it comes straight, and then it'll just come straight out. Then you hold it with a 2x2 and just very gently, very quickly touch the sides of the teeth one at a time, and the patient will very quickly identify the tooth that's the problem. Normally it's going to be a cervical. So I'm touching right at the gum line in the cervical area. Could be an occlusal, especially if you've got big fillings, but more times than not it'll be right at the gum line. And don't touch them very long, just barely touch quickly. So my assistant is marking what we found. These weren't sensitive at all. On a 1 to 5, number 2 was a 4, number 31 was a 2, number 9 was a 2, and number 15 was a 3, meaning they were very sensitive. These others weren't sensitive at all. So once you've done that, you decide what are you going to do with the tooth. Are you going to do endodontics? Are you going to place a sealer like Super Seal? Are you going to give them a night guard? Is it from bruxism? Is it from a deep filling in the tooth? We'll talk about differential diagnosis of pain in another Dental Minute video. And that is the Dental Minute.
Hey y'all, I know you loved this episode of the Dental Minute, and if you have not pressed subscribe, press subscribe. Press it now. What are you waiting for? Next week is such a great topic. We are talking about the bonding of a chipped veneer. You will not want to miss it. We'll see you next week.